Welcome back YouTubers to my channel of an everyday life with an Aspie. My name is AspieAnswersAll, and right now I'm just talking about in the new series right now about the sleeping disorders and basically their symptoms versus the treatments and every other bits and pieces I feel that would be worth addressing. So in order for the do, if you haven't been following me right now, I'm doing all about the different types of sleeping disorders, and this one's obviously covering the three parts of narcolepsy, which obviously in the first two parts was the introductory of narcolepsy, what it is, how it affects the patients that suffers from narcolepsy, and then number two was obviously the symptoms, what to look out for with those type patients that has it, that are associated with narcolepsy. However, last but not least right now that I'm addressing to you all is basically treatments. So basically, in order to make a determination of narcolepsy, if you do have it or not, usually it pays to go to a doctor or some sort of, specialist that specializes in sleeping patterns or whatever they call themselves. I can't remember on top of the head the actual name for it, but basically this is important so that, if you do go seek the medical professional, be it the doctor or whoever, they can actually ask you as a patient to complete some forms for a complete medical and family history so that they can get right into what's going on into you right now. And then sometimes they may refer to you to a sleep center evaluation. And then after that, they may ask you to keep a sleep diary. I know it may sound bizarre for some of us that we should be keeping a sleep diary versus, everyday diary of our thought patterns and stuff, but this is important for them so, that we can record the symptoms and severity for at least a week or two, as well as basically what I used to remember. Basically, some people I know and especially me now, I'm trying to do is if anything persists in my body and whatnot, regardless of what I'm feeling, excuse me, basically is that, it pays too so that we can keep track of that, plus our, tablets, what we're taking maybe, and if all else fails, we can usually just focus on just, giving it to the doctors and just speaking out to them about how we feel about what we're being treated with. And also though, when that happens, basically, you gotta remember, like anything, there's no acceptable cure for narcolepsy or any other disorders I've been bringing out to you to this day, but it's all about managing and coping the best way we can, be it, if we're lacking in the nutrients. Obviously the key thing here is eating in the right nutrients, and basically another one is just, for example, is if we're not exercising enough, we're breathless, and that we need to keep that up. Symptoms can be elevated to a point though, however, for these patients, to the point of near normal functioning. Treatment for narcolepsy includes the use of medication as well as behavioural therapy. As we know, some behavioural therapy sessions may control symptoms. That will take 3 or more scheduled naps in between throughout the day. Okay, some people may need it. Patients should also avoid heavy meals and alcohol, which can disturb or induce the sleep patterns that needs to be dealt with. Okay, also they recommend basically counselling, which is very important for people with narcolepsy, because obviously, as I said before, the particular symptoms of this disorder basically isn't widely understood by the general public, and this may cause the patients to feel uncomfortable or alienated or depressed. Okay, in treating narcolepsy, basically doctors typically provide or prescribe, shall we say, stimulants to improve alertness and diminish the excessive daytime sleepiness, but it can't always guarantee to work. As I said before, obviously, it's up to us how we want to go about the right treatment for ourselves. Antidepressants are often also used to treat cataplexy, hyponanergic hallucinations, and sleep paralysis. And then last but not least, as a final treatment, is sodium oxybate, which is a strong sleep-inducing agent which may be able to help given to improve at night of these disturbed nocturnal sleep patterns that we have and reduce that daytime sleepiness we have in the mornings, as well as that cataplexy. But bear in mind, like any other treatments, basically of the medications and that, they do have side effects, and that Stimulants obviously can cause headaches, dizziness, irritability, mood changes, nervousness, insomnia, anorexia, irregular heartbeat. And another one of the side effects from the use of antidepressants may vary from person to person, like any other form of medications, like I said before. And this could include, but bear with me on this, is anorexia, or shall we say another one is, for the antidepressants, I should say, nausea, weight gain, anxiety, or the decreased emotions, basically, along with drowsiness, sexual dysfunction, and changes in the blood pressure. Sodium oxybate, the last not least kind of treatment that they may offer you, can induce nausea, excessive sedation, mood changes, and basically just to the point we can't sleep or whatever. Okay, obviously, as we know, the goal in using medications for anything is to achieve what the desired results that we wanted to achieve of the normal alertness with minimal side effects, obviously for this goal of treating narcolepsy. This is obviously, for another key example, is that, with some other meds, we want to have a goal of, maybe losing weight, I don't know. This is just an example, and basically, as we know that at this time, though, as I said before in my videos, I think that we need to bear in mind that, it can affect anyone. Last but not least, to end this, is the coping mechanisms. Basically, like tips and advice for your coping of this is, behaviour treatment of narcolepsy will include, as I said before, number one, your several short daily naps, 10-15 minutes to combat the excessive sleepiness. Number two, establish a sleep sleep schedule. So obviously, stick to it regardless. Say you need to go to bed, maybe say 8:30, 9 o'clock at night. Some people may think it's too early, but then again, your body may thank you for it, as well as everything else inside of you. Number three, maintain a regular exercise and meals schedule. And number four, last but not least, is avoid alcohol, nicotine, and caffeine. Well, that ends basically Narcolepsy series. Basically, give me the like for thumbs up. Subscribe to my channel if you haven't done so. Follow me on Twitter and Facebook, AspieAnswersAll. Feel free to share these videos. Do what you love what you do. Thanks for watching. Until next time, I'll see you all again soon.